Welcome to the special series of a Healthier Michigan podcast, coming to you from the Mackinac Policy Conference, where we're taking a closer look at one of the most urgent challenges in healthcare today, affordability. In this episode, we're discussing something many don't consider, but that affects all of us, uncompensated care. When someone doesn't have health insurance, it can be common to go to the emergency room because hospitals must provide treatment. But that care often goes unpaid by the individual receiving the care. And the cost doesn't just disappear. It gets spread across the health system, showing up in higher premiums for people who do have insurance. So how do we reduce these hidden costs? What role do charity care, free clinics, and state and federal policies play in keeping people covered and preventing emergency care from being the only option? We'll break it all down with the help of hospital leaders, insurers, and policymakers who are working toward affordability and access for everyone in Michigan. Our expert guests include Rob Kasseluk from Trinity Health, Andy Hetzel from Blue Cross Blue Shield of Michigan, Congresswoman Debbie Dingell, and others who are helping us to connect the dots between coverage, community care, and cost. So dropping by our big, beautiful blue backdrop and table is Andy Hetzel, who's Vice President of Corporate Communications at Blue Cross Blue Shield of Michigan. It's good to see you.
Well, it's good to see you, and I'm happy to be here finally as the executive producer of this podcast. I'm a guest for the first time, so I'm very excited.
Don't you have people who could pull some strings? I mean, you could have been here a long time ago. Yeah, it's great to see you nonetheless.
Thank you, Chuck. They prefer to keep me behind the scenes.
Oh, okay.
I'm here to talk about something very important to us today, so I'm pleased to be here.
Well, and we've been talking about this on the podcast. When people go without insurance, it obviously makes healthcare insurance or healthcare itself more expensive for all of us. Can you explain what happens in this process? Because I don't think everybody computes this in their mind. They get their blue card, they go and they get treated, but there is a cost to this.
There is, but we need to start with the people first. We need to talk about the people who actually are uninsured and what we as organizations that are involved in healthcare in Michigan do to support our broader community and the needs of people. And Blue Cross is significantly invested in this effort, but so are our partners in care, especially the nonprofit health systems in Michigan. So we have a state that's fairly unique. Most of our health systems are nonprofit, which means that they are mission-driven to open their doors to everyone through their emergency rooms who needs emergency care. Many of those people come to the emergency room because they don't have health insurance and they don't have a regular doctor relationship, and they find themselves in situations that are very desperate, and they wind up in the hospital emergency room, which is a very expensive place to receive health care. And considering that many of those conditions are very bad at the time that those people seek care, they become complex and expensive to treat. Oftentimes, a health system will try to collect the cost of providing that care back from the person receiving it if they don't have insurance. Most of the time, that effort is unsuccessful, and so the health system can't collect on those folks, and so they charge off the cost, and it goes into a part of the ledger that every year they compute. It's called charity care. Every nonprofit hospital does it, and those costs eventually find their way back to be paid for by the profitable side of that health system's revenue base, which is commercial insurance, like Blue Cross Blue Shield of Michigan, other HMOs in Michigan. We pay part of the hospital costs for that charity care through our negotiated rates. And so that's where the connection point happens between people without insurance, the health system that provides the necessary care because they have a mission to support those people, and the commercial payers and our members and customers.
So there are many ways to create a stopgap, I will. One of them could be a free clinic, and I know that Blue Cross has been involved with, some of these organizations that are partners, really true partners for decades, right?
Yes. The nonprofit network of free clinics in Michigan does extraordinary work. Volunteer doctors and nurses in the community, keeping access points available to people who are without insurance for some reason. They've lost a job, they're between jobs, they can't afford the subsidized health insurance on the marketplace. They earn too much money through work to qualify for Medicaid. They're uninsured. So there's a gap there in the safety net. And we help fill that gap by providing financial support to these free clinics. And over the last 18 years, Blue Cross Blue Shield of Michigan is the largest private funder of our network of free clinics. So about $18 million we have given to that network of clinics to keep their doors open, provide essential services to people who are underinsured in our communities, and down the line, helping to prevent some of that uncompensated care that we were talking about in hospitals at the beginning of our conversation.
So examples that you could give us of investing in primary and preventative care that seems to help this idea of avoiding these expenses being passed through, right? Preventative care we've talked about for years. A lot of us practice that in our own lives, but you don't really assign high value to staying healthy in advance because sometimes stuff happens.
The stuff happens, and when you're uninsured, you simply do not seek out preventive care. I mean, you don't get vaccinated, you don't go for a checkup, because when you're uninsured, you have to pay out of pocket for those services, and it's sometimes very tough to do on a family budget when that budget is already strained. And so the free clinics that we support in Michigan have expanded their use of preventive care services in the clinic setting, so patients can go in, they can see a doctor, they can have conversations with that physician about their health conditions, they'll get advice, they can get vaccines, they can get preventive care services in the free clinic setting. That keeps their health better than otherwise, prevents those conditions from worsening, like we were talking about at the beginning, and those folks ending up in the hospital emergency room unable to pay. And again, all of that translates into better care for people, support for people in need in our communities, support for our nonprofit health system partners, and down the line, support for our members and customers through better affordability of health insurance.
Well, so you're kind of explaining this, this connecting point between insurers, policymakers, communities. I mean, so many, titans of those industries are walking around here on Mackinac Island, this week. And how did they all support the safety net? Is it viewed the same as it is by Blue Cross, this idea of tightening up the netting, if you will?
Yeah, the safety net needs to be thought about as sort of a continuum, okay? Because in every community, you have people who are less fortunate, you have people who are more fortunate. The more fortunate people can access services in the healthcare system more easily than people who are less fortunate. And so as an organization that serves all people in Michigan, everywhere in Michigan, Blue Cross is invested in making sure that access points are available whatever your situation. So we're very proud to serve about 5 million members here in Michigan and around the country with excellent health insurance. And we're proud that our health insurance gets them in the door to see their doctors, to have their surgeries, to have their babies in the hospital, provide the services necessary to keep them healthy and well. We're proud of that. But outside of that, we're also equally as proud to support the safety net in our communities, to support people in need and really deliver necessary services in the healthcare system in concert with physicians and nurses and hospitals to really provide that continuity of care access points here in our state to make sure that we're taking care of people.
Well, it's really good to know. It's good to know for all of us because this explaining it the way you have brings home the idea that it is eventually possibly costing us all something.
Yeah, and these free clinics provide an essential service. They serve about 400,000 emergency room visits they have prevented over the last 20 years by serving people at the community level, in the community setting. And those avoided emergency room visits have translated into $200 million in avoided costs in our health system that have not made their way into the premiums that people pay for their private health insurance. So that story is about us all being in this together. And by working together and supporting each other, we can help people who pay for private health insurance. We can help people without health insurance. We can help make our communities healthier and work together as partners.
It's all good stuff. Andy, it's good to see you.
Good to see you, Chuck.
Yeah, thanks so much.
Thanks.
Rob Casselou joins us. He's president and CEO of Michigan Region Trinity Health. Good to see you as always.
Yes, great to be here and good seeing you too.
Yeah, at the same time next year, right? It's kind of like Groundhog Day, the movie. I get to see you again, but that's a joy.
Yeah.
You know, a lot of the focus now is in this conference is about affordability of healthcare. Charity plays a big role in that as well, right? So why is it important for us to understand that charity connection to hospitals?
Yeah. Well, we're all hospitals provide some level of charity care. For us at Trinity, there's two reasons. One, it's part of our mission. It's part of what we stand for as a faith-based health system, but also it's our obligation to the community. We're not for profit. We need to return value to the community. And also, charity care is important because if we don't provide it, people don't get care, and then they get sicker down the road. And then they end up in an emergency room, and the costs are even higher. So there's a lot of reasons to provide it.
Well, that's an interesting thing when you mention emergency care, because that's the first line of defense, or at least the first thing people think about often is let's get to the emergency room. And there's this idea that if you get to the emergency room and you can't afford to pay the bill, well, that's just the way it works. But that really is something that affects all of us down the road, right?
Absolutely. And when someone comes into the emergency room, we're not doing wallet biopsies, okay? We're not looking at their but then later on, emergency rooms are very expensive. So you have to think about those costs. Those bills come due. And so that's when we have a financial assistance policy that gets in place because we don't want to have anyone become medically bankrupt.
And I guess for me, as a consumer, just wearing that hat for a minute, just walking around everyday life, I've never really given as much thought to unpaid care as I had in thinking about even talking to you today.
Oh, yeah. Well, we're thinking a lot about it now because it's gone up so substantially over the last couple of years in particular.
So when you look at the universe of what's happening in insurance, what solutions do you think would help expand insurance coverage, and for what? Like, what do people need? And when they're in need, what could be better for them?
Well, right now, the hot topic is Medicaid and what's happening in the federal level. And we're looking at some bad things happening with Medicaid and a lot less of our community on Medicaid going forward. That means our uninsured ranks are about to grow dramatically. And so our charity care will go up as a result. Now, when you look at the people that are in the gap, the people who are now not going to have Medicaid, but they can't afford private health insurance. They're in that kind of no man's zone, right?
Even through the exchange, they can't afford that.
They can't afford it. So the solutions really may be more about how can we help them in that gap, how we can provide insurance at a lower cost. Or in some cases, it's about social needs. It's more about their access to food or housing, what they call the social determinants or influencers of health. Because a lot of times those lead to consuming healthcare. If we can keep them from consuming healthcare, we can then avoid a lot of that charity care.
So when you look to support vulnerable patients, then part of it is charity care, but this other part is really getting ahead of the curve to extend your health span, right? I mean, you're trying to get your health span, not just your lifespan. We all want to go as long as we can, but to try to be healthy along the way.
Absolutely. Every patient who comes in our hospitals or in our clinics, our medical offices, are screened for social determinants. We want to know, are they isolated? Can they read? Do they have literacy to understand what we're telling them? Do they have food access? All of those issues. And what we do is connect them with resources to try to solve those, because often solving those solves some of their health issues as well.
And very often, if you live in a food desert, right, you don't have access. It may be the party store at the gas station is the closest place to find food. And we all know those choices are not always the best. Not disparaging those guys, but it's not always the greatest choices.
Yeah, unfortunately, we have a lot of food deserts in Michigan, and where they are, it's processed food. It's high salt, it's high fat, and obviously that leads to diabetes and other issues.
So do you feel your job is also educating the public, not up to the point in which you're seeing them in an emergency situation, but even in preventative care, right?
We've made a tremendous investment at Trinity in that. We have farms now at 3 of our hospitals. We provide a food hub in Ann Arbor. We, provide housing options. We're outside of our classic, what I'll call traditional healthcare mode in a lot of the investments that we make.
Anything else exciting that's happening right now in the Trinity system? Because life in general is changing at the speed of light sometimes. Yeah.
Well, I think right now what we're trying to do, we're in 25 states, and Michigan's our largest presence, which I'm happy to say, but we're in 25 states. All those states are in a different place, both politically, economically, what's going on with Medicaid. I think for Trinity right now, what we're trying to do is remind everyone we're here to stay. And we're going to solve these issues, but we're concerned right now about the charity care, the rising. It's doubled for us in 2 years here in Michigan, the unpaid costs of Medicaid. So these are becoming burdens we're trying to figure out how we're going to solve in the years to come.
And when you say in the last 2 years, that's looking in the rearview mirror. That's not including what's all been talked about in recent time with Medicaid.
Oh, yeah. In real dollars for this year that we're in that ends in June, our fiscal year, $43 million of actual unpaid care. $20 million of uncompensated care from Medicaid just in Trinity, Michigan. Multiply that by all the health systems. It's a huge number. Yeah.
Well, we're glad you're here to help us navigate that moving forward. It's good to see you, Rob.
It's good seeing you too, Chuck. Thanks for the invitation.
Oh, you're welcome. Congresswoman Debbie Dingell is with us, Michigan's 6th District of the U.S. Congress. It is nice to see you.
Chuck, it is great to see you.
And may I speak of your shoes?
You may speak of my shoes.
They're all shiny and glittery. They look like Dorothy's shoes.
Well, some of my friends are trying to get me out of heels, particularly in parades. So, because, I've been known for walking in parades for decades in heels. So I said, okay, I'll go to Skechers, but they're going to look good.
Do they feel good, though, all the hoofing that we have to do?
Yeah, actually they are. I have to adjust to Skechers from heels, but yes.
Well, they look great.
Thank you.
Yeah, it's really good to see you. So we're talking a lot this year about affordability. I'm hearing a lot of people from county governments to hospital systems to nonprofits talk about partnerships. And I'm so encouraged that, I just mentioned this a minute ago, cats and dogs are starting to live together. We've finally figured out that we can have partnerships across political aisles and from government to private and beyond. Isn't that encouraging to you?
Yes, it is encouraging. I've spent my whole life trying to build those partnerships and bring people together. Though, quite frankly, I wish I was as hopeful, optimistic as you are, because I also think it's more partisan than I've seen in a very long time, especially when it comes to issues like healthcare and Medicaid and food assistance. So let's pray.
Well, I'll do that. And then let's talk a little bit briefly. We could go on for a while. Federal programs, Medicaid, ACA subsidies, they've all helped people get insurance. Why do you think keeping these programs in place is important for healthcare?
I know why they're so critical, because we've expanded the number of people that have access to health care. We've expanded children and families. And I'll never forget when Rick Snyder, our Republican governor, took advantage of the Affordable Care Act. And actually, John Dingell and Rick Snyder stood on the stage at then Oakwood, now Corwell, and it was like two little kids. They knew that they were going to make a difference in people's lives. And the bills that we've been considering, the bill we passed in the House, which I pray is not going to be the final bill, is going to rip health insurance away from millions of people across the country, 14 million to be exact, but here in this state, hundreds of thousands, and that worries me.
So is this the biggest risk in your view of people losing coverage? The single biggest risk, or are there others?
Well, the Medicaid bill that just passed is obviously the big one right now, yes.
So when you look, let's talk about being optimistic. You're at a conference here. You're seeing a lot of different people, speaking to different people, and they're approaching you. What makes you optimistic about trying to make healthcare more affordable?
I don't think right now we need to make healthcare more affordable. I'm working with my buddy Carter, who's a Republican from Georgia, on how do we make prescription drugs more affordable? How do we lower the costs? Hopefully someday we'll get to the bills that we've introduced together. We've got to get through this reconciliation and budget period first. But right now, we're not talking about making healthcare more affordable. We're talking about how do we ensure the people that have it continue to have access to it. That's the number one fight right now. And the other thing that was in this bill, Chuck, that really worries me is it's the biggest cut in food assistance that we've seen in the history of this country. I just don't think a child should go to school hungry. And, we saw the report yesterday of how many children in Michigan were homeless that were going to school in this state. These are moral obligations we have to try to give every child a healthy start, a good start.
And we've talked to hospital leaders who have also said that some of these ideas of getting all of us healthy, but especially with kids with food insecurity, some of the tangible results may not be known for 20 years. But how can you go to school and learn if you don't have a breakfast? It seems really basic, and yet we're still fighting some of these battles, right?
We're fighting these battles more than we've had to in recent years, and that's what's at stake right now, and that's what I'm going to fight for tooth and nail.
So uncompensated care in hospitals is a big one, and that leads to affordability. All of us tend to have to pay for that in one way or another. Maybe we don't see it coming. So this idea of getting people healthy in advance is one way of maybe we stay out of the ER. But that's another part of this puzzle. It's another big piece.
So if people have Medicaid or they have access or they have health insurance, they'll hopefully do more preventative care, go to the doctor when they're sick. They're not afraid to call until they wait until they're so sick that they end up in the emergency room. And you are correct about uncompensated care increases the cost of health care for entire communities. So it's another reason why we want to get preventative care right now, preventative medicine, teach people healthy ways, teach people how to eat correctly, get the immunizations that they need. If an immunization is free, they're going to get it. And that helps keep people healthy. And, but the Affordable Care Act covers flu shots and now we're having a debate about what immunizations people should be getting. And it's a very interesting time in our country's history.
And we've also heard from people on this podcast in the past couple of days. You talked about food insecurity. If you don't have transportation to go get a flu shot, you may wind up sicker and wind up in the ER at some point. So there are all these pieces that point to outcomes that we all don't want to hear about.
Well, we got to hear about it, and we got to work on it together.
So working on it together includes lawmakers working with organizations like Blue Cross Blue Shield of Michigan, making things better. Are you encouraged there by the partnerships that you see and hear about?
I've always worked with Blue Cross Blue Shield. And last night I had some of the hospital leaders and Blue Cross Blue Shield in one room and said, we're all doing okay, all right? And there have been some tough negotiations, but quite frankly, I heard, we were able to get Michigan's 2025 Medicaid application approved by HHS in January, and the hospitals and Blue Cross Blue Shield worked together on that because they knew the patients that they were going to take care of needed that. And that's what we all need to be doing more. All of these issues that keep our communities healthier, that help take care of our children, take care of our seniors, take care of working men and women. If we can all support each other, nurture each other, we're all healthier and better off for it.
And while we do tend to focus a lot on kids because they are the future, the senior population, the increasing age of the average age of Americans points to all kinds of other issues that are coming at us like a freight train.
They are. When I've been out and I've had people just burst into tears. A woman whose husband has Alzheimer's, who's in a nursing home, said to me, are they going to throw him out? Am I going to lose my coverage? Medicaid's the largest payer of long-term care in this country. And many people just need a helping hand. They want to stay active and alert and in their own communities. It's why I've been trying to get home and community-based care passed. We got 1 million people on the wait list right now. So there are a lot of things we're working on together. Blue Cross Blue Shield has been a great ally, as many of the healthcare groups and community groups, senior groups, caregiving groups have all been as well.
Well, Debbie, it's good to see you.
Chuck, it's good to see you.
Thanks. Representative Kurt Vanderwall is here with us, 102nd District, Michigan House of Representatives. Good to have you with us.
Thank you for the opportunity. We're excited to be back here on Mackinac.
Yeah, so let's talk a little bit about this session. The House Health and Policy Committee, you're the chairman there. What are the biggest priorities as you see it now for this legislative session as we look at health and wellness?
Well, there's several things that are top priorities of mine and I think of the state. Number one is access to care, especially when we're talking about rural situations and in those opportunities. The cost of drugs continue to be a prescription drugs. And then working right now on the 340B program is a statewide federal program, and very beneficial to our folks that are lower income and to the hospitals.
So you're creating maybe a tighter safety net, or that's the intention, right? So that folks don't slip through.
100%. It makes sure that the program will continue as strong as it has, and make sure that money filters to the ones that need it the most.
We're hearing a lot from various directions about partnerships and the idea that, government and private partnerships and nonprofits, they can all get together and help save all of us, from whatever's coming. But what role do you see local clinics, hospitals, health plans all playing a role in this supportive system that we all need?
Well, we just passed 2 bills out of committee last week that really helps all these partners work together and communicate, health records and your personal information. And as most people understand right now, under some of the things that we have, we don't readily share that information. So somebody that's going through a health crisis ends up at a different hospital. Now, if we can get this to the final leg and signed by the governor, it'll be just at the fingertips of all medical personnel, better outcomes, better care, and save a lot of money.
Well, and saving money is part of this, a big part. Affordability is a word that we're seeing a lot, especially from Blue Cross Blue Shield of Michigan. But it affects all of us. When you get it down to our level at the ground, where you're trying to save money for your family or your small business or even your large company, it's a big deal.
It is a big deal, and that's one thing that has been great of working with my friends at the Blues is ultimately we don't want our premiums to continue to go up. We need to work hard to do what can we put in place that's going to save, but yet deliver the outcomes we expect. So it's been a great working relationship, and we look forward to continuing that.
You've had a particular focus. A lot of folks may not know about the idea of advocating for solutions with insulin prices. So you've learned a lot, right? This idea of funding for insulin manufacturing in the plant in Michigan. What are you learning from that experience that's ongoing that can point to other costs, including other pharmaceuticals?
Well, you learn, number one, that not everybody likes a new idea, and they want to put roadblocks in. But you know what? The opportunity is just to continue to work together and say, okay, if we need to go a direction that we can save money but yet deliver a better outcome, and that's bringing it home to the United States or home to Michigan, it's really just working with our partners along the lines to make sure we deliver those opportunities.
Do you see other particular opportunities that may be akin to your experience there with insulin?
100%. I think, let's really look at all the drugs in the situations we have out there now. The 340B program is part of that. It's working to make sure that we deliver those things here in the state of Michigan. And sometimes people say, well, that's a federal issue. They're stalled. And you know what? We need to be the leaders. And I say sometimes we need to be the big people in the room. And let's work at it at a state level. And hopefully we can get enough traction. Other states follow suit. And then the federal government falls in track. But you know what? You got to work really, really hard. And everybody has, a finger in the pot. But you got to be willing to work with them to get things done and say, okay, how do we do it? And when you learn what you need to do, then you can take that opportunity and move forward.
Are you seeing this collaboration when you say other states? Are they looking at us as well? I mean, is this open architecture where, everybody's talking to everybody and doing best of practice and learning from it?
Yeah, we'll jump back to prior authorization. When we got that done, we believe it was the best in the country. We had many, many states that made phone calls and says, how did you do this? What can you give us in hints so that we can get it done? And a lot of other states have moved into the same format as what we've done, and it's been working phenomenally, both with the insurance companies and the providers to deliver those quick outcomes, which ultimately comes back. If somebody has quicker care, the outcomes are better, and we don't go down a path of continuous sickness.
So quicker care, sometimes that's hard to achieve when you're in a rural area. So when you look at maybe some of the biggest barriers that you could point to, especially in this state, in rural areas, where do you see we should be focused?
Well, in rural areas, we got to continue to make sure that we have a solid internet. Today, with the expansion of telehealth, it's extremely important, especially for our aging communities up north. And the demographic is much older. And if they live in a very rural area, they don't have good, solid internet. It eliminates them for that opportunity. And if they have to drive an extended period of miles to get to a facility that's not convenient, it causes stress and other aspects in their life.
And it snows every once in a while. Yeah.
We just found that out with a great winter of not just only snow but ice, but those are real concerns. So telehealth is something that we've got to continue to develop, and that it's only going to be as good as internet access throughout the state.
So the assumption would be that internet access is great everywhere. Not the case?
Not the case. It's pretty poor, and I think come visit me in my district, and I can drive you 15 miles out, and you barely have any type of internet service at all.
So how do you push to get that done? Where do you push?
Again, it kind of goes back to what we talked about before. It's private-public partners working together. We have all the electrical lines running. If we can partner with that company to put up internet opportunities on those poles, we can deliver solid internet throughout the state of Michigan.
Well, Kurt, it's good to see you. Thanks for all you're doing.
Well, thank you. I appreciate it very much. It's always nice to see you guys.
Thanks.